An integrated care system is when NHS services work together with local councils and other organisations, such as the voluntary and public sector, to plan and provide better and more coordinated care to people. It works collaboratively to plan, deliver and review health and care services in a joined-up way. In South Yorkshire and Bassetlaw, services have been working together for many years. Our mature relationships have helped us to become one of the first integrated care systems in the country. Our vision is for everyone in our system to have the best possible start to life, with support to be healthy and live well for longer. We're working to ensure that people across South Yorkshire and Bassetlaw live longer and have healthier lives, live full, active and independent lives, have their quality of life improved by access to quality services, be actively involved in their health and their care, live in healthy, safe and sustainable communities. Our area covers a population of 1.5 million people, including 72,000 members of staff, 208 GP practices, 5 hospitals, 4 mental health trusts with a combined health and care budget of £3.9 billion. Since 2017, we've gathered thoughts and views from the general public on local services. Their ideas and experience have helped to create our new 5-year plan. The NHS usually focuses on treating people when they're unwell. We want to work with our partners to get better at helping people earlier and stopping them from becoming ill. People in South Yorkshire and Bassetlaw are not as healthy and die younger than people living in other parts of the country. Too many of us smoke cigarettes, are overweight, don't get enough exercise and drink too much alcohol. More of us have a mental illness than in the rest of the UK, including higher rate of deaths by suicide. There are many things that can contribute to making a person unwell, including where people live, how well they do at school, and their job. We need to focus on them all. We'll improve the health of people with severe mental illness and learning disabilities so they don't die younger than people without these conditions, and reduce the number of people who smoke, particularly pregnant women, people with severe mental illness, and people who do physical jobs. We'll improve cancer survival rates and help people find out earlier if they have cancer. Reduce the number of people who die from heart disease and reduce the number of people who take their own lives. We'll promote exercise and help people to drink less alcohol. We'll also plan to make sure children get their best start in life by providing better mental health support in schools and colleges. Since 2017, we've talked a lot with our patients and staff, as hearing their thoughts helps us to make sure the health services we provide are right for them. Our citizens panel give us their views about our work and health projects. This helps us to continue learning and improving our services. We're also developing an online membership system, enabling us to hear from more people more easily. We have plans in place to increase our workforce to ensure we can provide the care and support our patients need. This includes making the NHS the best place to work, bringing in nurses from other countries, and helping staff to move easily between different organisations. We'll also be supporting our top staff to become great leaders. We're going to improve our digital and information systems so that patients don't have to tell different doctors and nurses the same things over again. Patients will be able to use their devices to see their health records, book appointments, get healthcare tips and advice, and even have face-to-face appointments. We've teamed up with the Yorkshire and Humber Academic Health Science Network to create an innovation hub, a place where staff and experts can come together to find new ways of using technology to improve healthcare and keep people well. We now provide health and care in neighbourhoods, the communities you live in, places, the city, towns and boroughs, and the system, South Yorkshire and Bassetlaw. Primary care networks are when different services, led by a local GP, work together in neighbourhoods to make local healthcare services better. They might choose to work more closely with pharmacists, mental health services and link workers to help people get non-medical support around housing and benefit. Each place has come up with a plan to help people get the best health and care without having to go into hospital. We'll improve community-based services for people with breathing conditions, dementia, heart conditions, diabetes and stomach conditions, so they're better cared for closer to where they live. We'll also make sure people having a mental health crisis can quickly and easily get the care they need. Each place also has plans to help people who are getting older to stay well, including more community support for people living with dementia and new technologies to help doctors and families care for them. Since our 2016 plan, 2 urgent treatment centres have opened. This means less people going to A&E. Our plan is to open more urgent treatment centres and work with ambulance staff to stop people being taken to hospital when they don't need to go. We'll make it easier for people to book appointments by improving the 111 service and providing better advice to care home staff to stop them calling 999 when they don't need to. To reduce unnecessary hospital visits, we're trying new things like face-to-face appointments by mobile phone or tablet, earlier phone calls to give people good news about their test results, and more hospital services being available to people closer to where they live, for example in GP practices. Good partnerships are what will make health and care services better for patients. At South Yorkshire and Bassetlaw, we want to work with our partners to be better at research and be offering more new technologies so we can improve services for the future. To keep money in the region, we'll also offer more local jobs and buy NHS supplies from local companies. There are many volunteering organisations and community groups in our area. We're committed to working more closely with them to look after the people in our region. All of the health and care organisations in South Yorkshire and Bassetlaw have agreed that we will work together, joining up services in an integrated way to ensure patients get the care they need.